Welcome to EuroTV at EuroPCR 2019. My name is Tommaso Gori from the University Medical Center Mainz, and I'm here with Dr. Nikos Mezilis from St. Luke's Hospital in Thessaloniki. We're here to talk about complex PCI and LV assist devices. This is kind of a complex theme as well, and there is a lot of controversies and less data about it. So, Dr. Mezilis, what is complex PCI? How do you define it?
Complex PCI, obviously, it's a complex answer to give. Obviously, there's no objective evidence what's a complex PCI, but most of us would agree that a PCI which is complex relates to three major variables, which are first the anatomy, whether we are dealing with a bifurcation left main or a very long calcified vessels requiring rotablator, for example. The other variable is the clinical presentation, whether this is a STEMI or a non-STEMI. And the third, and quite important, is patients' comorbidities, characteristics such as advanced age or diabetes, renal failure, vascular disease. So all these constitute what we call high-risk PCI. And I think it's very difficult to predict which PCI might go wrong, but that's the issue to discuss, how we can anticipate and maybe do something in advance in order to prevent adverse events during such a PCI.
So anticipate, and what can we do? What devices are available to do it?
Generally, there are four types of devices. There's the old balloon pump, obviously, which does not give much support. I mean, it adds about 1 liter per minute at most. And the problem with the balloon pump is that it requires some sort of left ventricular function. You have to have a decent ejection fraction in order to get this extra liter. There's the impeller system, mainly the microaxial flow, that what it does, it pushes blood from the left ventricle to the aorta, and obviously helps a lot, mainly the left ventricle, to unload the left ventricle, and it's widely used now in such patients with low ejection fractions and maybe decompensated heart failure with high-risk PCI. Then there is tandem heart, which is not so popular, which it's quite complicated with a lot of maybe possible adverse events. And the last and probably the most powerful of all is the veno-atrial ECMO, which is a system that supports not only left ventricle but also right ventricle and enables gas exchange. So these are mainly the four devices that are available in most institutions.
Yeah, so those devices require large bores, so it's a large access, arterial and sometimes venous as well. That comes with risks as well, so you need to have data to support their use. What data are available for protected PCI? I know this is a hard question.
Right. Basically, there are two scenarios. You either use these devices in a patient who is in overt cardiogenic shock, and here there are some data, and that is reflected on the guidelines. The recent guidelines on revascularization mention that ECMO, for example, can be used as a 2B indication, obviously in the lack of randomized trials. On the other hand, we have a couple of studies with Impella, one in high-risk PCI, the PROTECT-2, which didn't show much difference, but there was a trend in favor of Impella. And for the balloon pump, I think the randomized trials failed to show any evidence. So there is some data, although randomized trials are lacking, and that's the problem. I mean, you cannot base your decision on hard data in order to anticipate which patient is going to benefit from.
But your experience is very important, so you have to base your decision on your clinical experience.
Oh yes, I mean. So surely the experience is probably the most important thing to decide, and probably it's important for the hospitals and institutions to make their own protocols in how to proceed with a
Yeah.
patient.
And this is
high
a very
risk.
important part of the planning. Yeah. Now, the one hard point that you need to decide as the operator involved in those procedures is when to start LV support. Should that be before the procedure or during the procedure when you see that it goes wrong? And how do you decide that it's going wrong if you say during the procedure?
Yeah, it's always better to start up front, especially with systems that require quite invasive procedure like an ECMO, where you need large tubes, and it's going to be very difficult to sort of stop in the middle of the procedure on a patient who is going to cardiogenic shock and start using the ECMO. You need to mobilize sort of the personnel and all this stuff. So for the ECMO, I would say that it's better to use it up front. Now, for the impeller, there are, quite a lot of colleagues that they're using after they start the procedure or during the procedure. I think the most you can get is when you start, you anticipate that that's going to be difficult, it might go wrong, and so I need some support here, and put the system up front at the beginning.
So as you said, it's a team effort. It's something that you have to decide and fit to your routines in the cath lab and to your team. We are the physicians, we are the operators, and high-risk PCI is when our skills are demanded, when everything becomes hectic in the cath lab, and at the end, we as operators are the ones that get the ticket to come to Paris and have fun and go maybe on Euro TV. But at least this is something that I really clearly want to say, at least 50% of the success of those procedures depends on the whole team. Nurses, technicians, other physicians, and maybe even the IT, the purchasing, the pharmacy, and the accountability at the end, because we all live in an environment. So what I would like to suggest our spectators is that they should take a day off, maybe a Saturday off, invite their teenager kids, so in kind of team bonding and family bonding as well, do a CPR training, do a resuscitation training, and do learn how to use those devices in a friendly setting, in a more relaxed setting before it becomes hectic in the cath lab. So with this I close. This is Tommaso Gori from Mainz. I was here with Dr. Mezilis from St. Luke's Hospital in Thessaloniki, and thank you very much for watching.